Parents have been twisting my arm, asking me lots of questions about a common childhood injury called a nursemaid's elbow. Well, let me see if I can lend a hand on this particular topic. Nursemaid's elbow is a common childhood injury occurring to children between the ages of 1 and 5. Sometimes it's called a partial dislocation of the elbow. In medical terms, we call it subluxation of the radial head. But most people simply call it a pulled elbow because of the mechanism by which this injury occurs. Why does the elbow dislocate? Well, in young children, the ligaments that hold bones in place are quite loose. So it's quite common with the right mechanism to dislocate the radius, a bone in the arm, and have it pop out of the elbow, causing what we call a nursemaid's elbow. What's the mechanism that does this? Well, if you pick up your little one by their hands or their wrists rather than their armpits, if you swing your little one, which is not a good idea, or if, perhaps like nursemaids did centuries ago, you pull back on your child's arm as they step off a curb because you're worried, well, that may dislocate the elbow. How do you know if your child's elbow has been dislocated? They may cry briefly, and then they're going to bring their arm into their side, slightly flexed, with their palm against their body. In that case, if there's no swelling or deformity, and they're not moving that arm, you should think about a nursemaid's elbow. What do? Talk to your child's healthcare provider. He or she will want to see your child, make sure it's not a fracture, and then we'll do a maneuver by which they extend your child's arm and then flex it, essentially very quickly to pop the elbow back into place, and your child will start moving that arm within a matter of minutes as if nothing happened. If it doesn't work once or twice, your doctor may get an x-ray to make sure that there isn't a fracture that's been missed. Can you prevent a nursemaid's elbow? Well, I'd like to say you could, but at least you can reduce the frequency by not tugging, swinging, or jerking your child's arm unnecessarily, so that hopefully tips like this will relocate any out-of-joint thoughts you have when it comes to knowing a little bit more about the nursemaid's elbow. This is Pediatrician Dr. Lewis First from Vermont Children's Hospital of Fletcher, Allen, reminding you to always be first with your kids.